This webinar is funded by Trees Call to Action Fund, which is developed by DEFRA in partnership with the Forestry Commission and delivered through the Heritage Fund. So seems I'll get started now, Una, so maybe you could share the initial slide. But so I'm Hattie. I work for the Centre for Sustainable Healthcare, and I work on the NHS Forest project. So I'm the Woodland Creation and Tree Planting Project Manager. And the NHS Forest project started in 2009 after the charity realised there's a need to draw attention to the importance of healthcare green spaces and their benefit for staff and patients and biodiversity. So I haven't got time to cover everything that we do, but for the last 15 years, we've done a lot, including sending trees to healthcare sites. And at the end of this season, which is the end of March, we'll have sent over 150,000 trees to NHS green spaces, which is incredible. We've also helped bring the Tree Equity Score to the UK from America. So that's an interactive map where you can see about disparities between canopy cover and access to green space. It's a really awesome interactive map. We've also helped develop green health routes. So these, we've been making and mapping green routes in and around hospital green space. We also have an annual conference and awards, which will be happening in about October time. And lastly, we have nature recovery rangers. We're actually recruiting for 4 positions at the moment. And these are rangers that are situated within a healthcare trust, and they enable patients and staff to use the green space by running activities or just making the green space nicer to use. So yeah, today we're going to be talking about how healthcare sites can create access to green space for health and well-being. The role of nature in promoting physical and mental health benefits is really well known. But obviously not all social groups have access to good green spaces. So today we'll be hearing from 3 practitioners from NHS sites across England that have supported marginalised groups to connect with nature. We've got Sandie Cain from Cambridge, Emma Myers, who's at Homerton Hospital in London, and Peter Temple in Cornwall. So each site works with different patient groups and has a unique approach to connecting these groups with nature to promote inclusion. Una, I can't see. Yeah, awesome. Brilliant. First of all, we're going to start with Sandie. So Sandie is a team manager at Darwin Nurseries and Farm Shop, which is in Cambridge, or the outskirts of. Darwin is an NHS-run site that provides therapeutic daycare activities for people with learning disabilities and/or mental health challenges. It's now approaching its 30th year. And it's a bustling farm shop, cafe and workshop where NHS staff work with their co-workers using horticulture and animal therapy to gain skills and independence. So I'll hand over to you now, Sandie.
Thank you for that introduction, Hattie. And thank you for inviting me to come and speak today. I'm really pleased to speak to you all about Darwin Nurseries. So yeah, Darwin Nurseries. Oh, can we just go back? Sorry, I'm not quite ready to move on yet. Thank you. So Darwin Nurseries and Farm Shop is a unique service providing day services to neurodiverse adults and adults with learning disabilities and/or mental health challenges. And we are in fact 30 years old this year. Our service kind of came out of when they closed the long stay hospitals and put people into the community again. And it was realised that we really needed to give some of the people that had been in hospitals for most of their lives activities to do within the day. So the county, the CPFT, or what it was at the time, bought a local county council cow farm for very little money, and we grew from there. Anyone can refer to Darwin Nurseries. It's open referral. You just call us up and we'll walk around and talk about the service with you and talk about what your aspirations are and the service that we provide. And it's a very simple and open way for people to refer in. And if we believe that you could benefit from the service, and you're able to be funded or fund yourself, some people pay for themselves to come, often people are paid by the county council, then you can have a service as long as we believe that you would benefit from it. So we'll go to the next slide, please. So we're a 7.5 acre site with a farm shop, which was originally a cow shed, and a cafe. Well, it's a cafe now. We also have another building that's a workshop where we run craft activities, and it's got a kitchen for the cafe. We have a picnic area, which is open to the public with a woodland. We have greenhouses, and we have a small animal farm. All of those areas are open to the public and community groups 7 days a week. At the back of the site, we also have multiple growing areas. We've got raised beds, permaculture areas, cut flower fields, polytunnels, and an ancient orchard. You can see here on the slide, one of our most famous products, if you like, is our specialist products is Darwin's Delights. So we grow fruit and vegetables. The co-workers are supported to grow fruit and vegetables. They grow them, they pick them, they cook them, they make them into fruits and chutneys, and then they sell them from the shop. And they even designed the labels. We also have a new part to our service, which is cut flower production. So not everybody loves growing fruit and vegetables. And some people like to see something beautiful. So growing the cut flowers is something else that the co-workers some of the co-workers do. So they grow them, they cut them, they prepare them, they make them into bunches, and then again sell them into the shop. Can I have the next slide, please? So our biggest income generator, and we are an income generating service. The aim is that we are cost neutral to the NHS. So our biggest sellers are hanging baskets and summer bedding, and also Christmas trees. The hanging baskets is a really good example of an activity where it is available to a wide, diverse group of people. So, for example, some people that come to Darwin are very sensory, and they're limited. For that activity, it might be limited to just breaking up the compost, the feeling and smelling the compost and making it ready for the other people to do the rest of the activities. Other people can fill the pots. Fill the pots with compost, make a hole with a dibber, put the little plant in, put the label in, price the label, lay it out, water it, and everything in between. So there's people who can do some of those activities, some people who can do all of those activities, and everything in between. Some people want to work in a group doing those activities. Some people would prefer to work alone. And that really makes the activity very accessible. It's also a very relaxing activity and very peaceful activity. And so that allows people to switch their minds off to things that might be in their head and make them present with the activity. Or it's so peaceful that they feel that they can chat about things that are on their minds. It's also very physical. It can promote dexterity. And obviously, when you're with other people, it reduces social isolation. Can I have the next slide, please? So, yeah, there's a lot of obviously opportunities within therapeutic horticulture for different benefits, and those benefits are different for different people. But you can see here that a sense of purpose is really important to the people that come to Darwin Nurseries. So it might be that they see Darwin Nurseries as their job, or they're volunteering. It might be just that they're coming because they want to see friends. But obviously there's other opportunities to gain, like work skills, or undoubtedly the physical health benefits are there, lifting compost, walking around the site, feeling the sun on your face, digging a border, walking on uneven ground that could help you balance, and of course the mental health benefits that the space can provide, because a lot of the activities are very mindful, using the outdoors to self-regulate, and obviously risk-taking is a big part of promoting independence and confidence. So that might be lighting fires, it might be using a mower or using tools. Can I have the next slide, please? So I just wanted to talk about two examples of two very different people that come to Darwin Nurseries and are supported successfully by the service. So one of them is a lady who's in her 40s who's been excluded from a lot of other services due to her behaviour. She's found that being with others is quite challenging, and yet she comes to Darwin Nurseries with 15 other people around her, and that's just the other co-workers. She often prefers to work alone and doesn't really see herself as having had a disability. She can have very intense responses to overwhelming situations, but she's learned over the years to take herself off and use the site to decompress. And we're 7.5 acres behind the glass houses, it's closed. She can just walk and let off steam. Often she'll come back having had a rant or a cry, and then tell us about the murmuring birds that she's seen or the blossom on the trees. And she's really benefited from being at Darwin, specifically for that, as well as being less socially isolated, I would say. We've also got a gentleman who comes who at times is very paranoid and feels very persecuted. And he comes however unwell he is. We work with him to provide space so that he can feel safe. And it's testament, he pays to come himself. He isn't funded. He uses his own money to come. And it's a testament to how safe he feels at Darwin that he comes. And you know what? He's our tomato grower. He said when he came to Darwin Nurseries, I want to learn to grow tomatoes and I want to look after chickens. And that's exactly what he does. He sows the seed, tomato seed. He plants the plant in the polytunnel. He trains it. He waters it. He weeds it. He picks it and he takes it to the shop. And sometimes it's really hard for him to be at Darwin Nurseries, and we have to take his cup of tea out to the gazebo for him to feel safe to be there. But he comes however he is, and I think that's a real testament to the great work that we do. Next slide, please. So we also keep animals. We've got 3 Cooney pigs. We've got 3 Hebridean sheep. We've got 2 pygmy goats and an Anglo-Nubian goat. We've got loads of chickens and ducks, and we've got 3 rabbits. So the benefits of working with the animals, apart from having another activity, a different activity that people can access that they might not otherwise access, is if you're a looked after person all your life, looking after animals helps you to understand what it is to look after. It brings about compassion. It's a loving relationship, but it's also physical contact. I mean, you get to cuddle the chickens. Who's the one to cuddle the chicken? Also, you're outdoors every day. You can't not go outdoors if you're looking after the animals. They always need to be fed and cleaned, and that keeps you in touch with nature. And it's a challenging site, but you know, there's people who have very limited mobility who still go out to the animals and still take part in some or all of the activities. And it's a testament to the staff that they can break down each of the parts of the work that we do into smaller and smaller parts to ensure that anybody is able to access some of the activity. There's also something about love and kindness and fun that you get with the animals, which is a really special part of Darwin Nurseries and something that people often talk about. Next slide, please.
1 minute left.
Cool. I nearly forgot the cat. He's the boss. He is actually our pest control. But it's just to remind you really of how mindful you need to be when you're with animals. You can't really be in your head. You've got to be present with the animals. And that's really something that's really important about what we do. Next slide, please. Okay, so we are income generating. And why is this relevant to you? Because you can also generate income. Plant sales, veg sales, fruit sales, cut flower sales, they all bring in income, even if all you're doing is just growing a few veg or growing a few cut flowers. And that helps to run a service because there isn't a lot of money around. We know that. Next slide. We've just developed a new cafe. We did it without any funding from the NHS. We raised a little bit of money. We got volunteers to help. We now have a very little cafe where we can make food that is developed from the food that we grow, and it brings in about £1,000 a month that we didn't have before. We're also using this 30th anniversary to make it bigger and better. Next slide, please. So we're a hidden treasure, but it's not just about the co-workers, it's also about our community. Our service is open 7 days a week, so other community groups can come and use our service, whether it's kids, whether it's schools, they come and use our picnic area, which is free. Next slide, please. CEO of Thrive came to see us and talked about how we focus on abilities and opportunities, and focus on outcomes and enterprise. And I was really proud that he came and really appreciated what we do. Next slide, please. We have recently got a Gold Green Apple Award, Environmental Award, for the care that we provide to the site, whether it's water collection, no-dig gardening, reducing waste, composting, no use of harmful chemicals, promoting biodiversity, or peat-free plant production. We do it all. And last slide, hot off the press, we will be at Chelsea Flower Show this year as a partner to Cambridge University. We'll be providing hanging baskets for them.
Oh, thank you, Sandie. It's fantastic. It's really exciting that you're going to be at the flower show as well. Yeah.
Thank you.
Yeah, I hope to come and visit some point soon. And I love all the animal names. I wonder how they're chosen. We'll move on swiftly. I think we've got a huge amount of time, but I'm going to introduce Emma Myers now. So Emma is the horticulture therapist for Homerton Healthcare in Hackney. She works across acute community departments from stroke rehabilitation to palliative care. Her gardening provision supports patients' recovery, promotes wellbeing, and improves quality of life through food growing and nature connection. So thank you, Emma.
Thanks, Hattie. Can you hear me okay?
Yeah, all good.
Great. Hello, everyone. Thanks for having me, and I'm really glad to see so many people joining us online. It's really exciting. Are my slides there? Yay, fab, thank you. So my name's Emma. I'm the horticultural therapist for Homerton Healthcare in sunny Hackney. I'm an OT by background, and so if there are any allied health professionals out there, I've framed this little presentation using the PEO model. If you're not an allied health professional, don't worry about it. That bit is trying to shape things in different ways of thinking. So the PEO model, we are going to think about the people that we're working with, the environment that we're working in, and the occupation that we're delivering. So here I am today to talk to you about how I prioritise inclusion at the Homerton in Hackney. Fab, next slide, please. So we have a really diverse population at the Homerton, and in fact in Hackney, there are around 93 different languages spoken in the borough of Hackney, which is a big population of different people. We have 5, I'd say moderate-sized therapeutic gardens at the site. And as Hattie said, I work across acute and community. So I'm working in neurological rehabilitation in several different services along the patient's pathway. I work in a stroke unit. I deliver sessions with elders, children, young people, people who are within our service for palliative care or maybe respite care. And I also have people that come in from the community to come and do sessions. So we've got a really nice web of delivery. So this slide really was showing a few different ideas about ways that we can develop adaptations to include the individual in the therapeutic horticultural provision that I deliver there. So here you can see different people with different abilities, different needs and different interests, different motivations and purposes in why they want to connect to therapeutic horticulture sessions. So we use the 5 pathways to nature connection as a kind of overarching umbrella for our provision. And those 5 pathways are contact with nature, exploring the beauty of nature, thinking about the emotions that nature brings us, the emotions that it might evoke in us, and the emotions that we might evoke by being in the natural environment, and the meaning that being connected to nature has for us as people, and the compassion. Sandie was talking beautifully about the animal care and the compassion of nature connection. Plant care, animal care, caring for our environment is a really important theme for us. So, as I said, you can see the diversity of activity here. When I'm delivering sessions for a very broad range of people, a lot of people that come to my session have got physical limitations to their engagement. And so the provision is about developing adaptations to enable people to access gardening. That might be at that acute phase when they are particularly unwell, or if they've got now a lifelong condition, thinking about how we can support them to engage lifelong in the activity of gardening, so that that's something that they can participate not only while they're within our service, but also when they're moving on and transitioning out back home into the community or into supported living environments. Because the primary reason that people are in hospital is physical reasons, or that they might be coming to my service, that doesn't mean that they're not experiencing mental health issues or social isolation. So we're working in a holistic way for the people that we work with. Could you move to the next slide, please? The next slide is something that I wanted to show you, just thinking about environmental changes that we can make. So thinking about that PEO model, what can we change about the environment to make it more accessible for gardening? So here are 2 great pictures of the same bit of equipment, actually. This is a piece that we persuaded the manufacturers. It was designed for children to be able to access gardening, and we persuaded them to make some adaptations to it so that we could use it in, this is actually in the stroke unit at the hospital. So it's an accessible gardening station, so you can get wheelchairs right underneath it. And the chap that's talking to me in the picture, the round picture, he's in quite a standard wheelchair, but he can slide underneath and garden in these little pocket gardens, which is brilliant. The chap on the left in the square picture, he's in quite a complex bit of supported seating that's going to enable him. He's got limitations to his core strength, so he can't actually sit up unsupported. So that the higher part of it allows him to be able to come under and access growing in that way. He gave us a beautiful quote, which was, when you're lying on your back all day looking at the ceiling in hospital, going in the garden, it's like going on holiday. I think that's pretty special, isn't it? I think that probably speaks to all of us. So we can change the accessibility of the environment by using things like these great bits of equipment, or maybe raised beds, or we can garden in 2 pots. We can put trays out whether people can have standing tolerance and they can use that as part of their rehab to do their gardening, or we can put trays onto wheelchairs or onto tables so people can access gardening that way. We can use pots, we can use trugs, we can use hanging baskets, we can use vertical growing, horizontal growing. Maybe we're going to garden on ground level for people that are looking to build up that type of tolerance in activity and exercise. So yeah, we've got really diverse spaces, and that just, the more diversity we've got in our spaces, the more accessible our growing environments are. Sandie talked about the ground, and that's certainly something that we explore at the Homerton. So can we make adaptations to the surface to increase inclusion? Is that about making a smooth pathway for people who are wheelchair users to be able to get up to the beds easily? Is that about creating different textural surfaces on the ground? So we're increasing challenge for people who are looking at their standing and walking tolerance in rehabilitation, and how those changes to the environment might make that replicate the outside environment, thinking about how they're going to be moving forward outside of our services. If we look at the square picture, you can see a really brilliant tool in that lovely man's hand. So it's an adapted gardening tool. So instead of having a handle in line with the device, it's got a handle at a 45-degree angle. So we're reducing the impact, the physical impact, to make the gardening more accessible for him. That tool also comes with an extension and a cuff, so that you can, again, if this is too complex a tool to use, you need something that's going to give you more power with a reduced mobility, then that's giving you that kind of turning power as we go up the joints of the arm. So we need more leverage. So that's a really great tool. We can also think about different things that we can do with the equipment we're using. So outside of the tools that we're using, we've got all sorts of different sizes of watering cans. We've got hoses, we've got water butts. So we've got all kinds of different ways for people to engage in the activity of watering. We use all sorts of different ways of planting seeds. So that might be about using seeds direct. It might be about using seed planting tools that we have, or we might use things like seed tapes. So that there's different ways that people can engage in the sessions, just bringing more and more variety in. So there's something for everyone, and also something that maybe somebody might start off using a seed tape and then move to using a seed planting tool, and then be able to move on to be able to do that independently. So we've got ways of dialing down or dialing up the support to allow people to engage at all different parts of their journey. So those are physical inclusive adaptations. The next slide is all about the occupation of gardening. And we're doing lots of food growing at the Homerton. Would you mind putting the next slide in? So we're doing lots of food growing at the Homerton, and this slide is just thinking about the different types of crops that we might be growing that promote inclusion in the garden. So I've put a list there of fun things. I spelled Yacon wrong, apologies. It should be Y-A-C-O-N. Yeah, just the slide previous, please. So in that lovely list of vegetables that we were just looking at, we've got things like callaloo or amaranth, which is a national dish of Trinidad and Tobago. We have, if you mind popping back the previous slide, thank you. We have oca, perfect, from the Andes, which is an ancient Peruvian food. We have tomatillo from Mexico. We use yacon from Colombia and Argentina. The achocha from the Bolivian mountains. We have the Cherokee Vale of Tears beans that we grow. It's an indigenous, Cherokee indigenous peoples of Southwest woodlands of America. So from the Tennessee and the Carolinas areas of that country. We can grow oca from Ethiopia and West Africa. We can grow goji berries and tune or Tuna sinensis from China. We can grow New Zealand spinach or Malabar spinach from India. We can grow Nepalese raspberries, red orach, which is part of that callaloo and amaranth family. But that is an Asian, or originally coming from Asia. And that's a plant that was grown by the Greeks and Romans. It's been recorded since 400 BCE. So that sounds like good, long-established good eating. You could also think about maybe growing something like an autumn olive, the Elaeagnus ambulata, which is a Japanese plant. Would you like to move to the next slide? Thank you. So my last slide is just thinking about when we develop inclusion in our environments, all of the other things that we're including. So here are some great pictures of all the other fun things that are happening by increasing inclusion in our gardens. We're developing relationships, we're learning, we are sharing, we're connecting to nature, we're connecting to the environment, we're learning about the weather, we're orientating to time and space, and we're having a really, really fun time while we're doing it. I think all of these pictures demonstrate it really lovelily. We're really proud to be part of the NHS forests, and we're very proud to have won an award for one of our gardens at the NHS Forest Conference last year for promoting inclusion in community settings. It would be delightful if anyone wants to stay in touch with me, share ideas, share practice, ask questions, share pictures. That'd be delightful. And on the last slide is just my contact details. If you're ever in sunny Hackney, be really lovely to see you. You'd be really welcome to come down and say hello. Come and see the things that we're growing and all the good fun that we're having down there. If you want to put my last slide on, then people can get in touch with me that way. Thanks so much for listening. It's been really great to see you all. Thanks so much.
Thank you so much, Emma. That's fantastic. It was really nice to see that adaptive equipment, and a lovely quote about him feeling like he was being on holiday. That's like really puts it into perspective, doesn't it? Great. So last of all, we've got Peter. So Peter is an Advanced Lived Experience Development Lead at Cornwall Partnership NHS Foundation Trust. She has a special interest in trauma-informed care and is currently working on developing the Healing by Nature project in the, I think, 3-acre woodland, which is within Liskeard Community Hospital grounds, and it's really exciting. So I'll pass over to Peter.
Hello everyone, thanks for having me here today. Hopefully you can hear me and the slides will come up in a minute. I think it's really lovely to have seen the other two speakers because they're much, much further ahead than we are down here in Cornwall, or our project is. But hopefully this will inspire people to have a go and to see what they can do and how they can do it. So as was said, my name is Peter Temple. I'm the Advanced Lived Experience Development Lead, which means that I'm somebody who's come through services, trained as a mental health nurse and a cognitive analytic therapist, come in to start a peer support and lived experience team in the trust. And as part of that, we decided to do, if I can have my next slide, please. We did a consultation process with our members and then with the community to find out what people thought that could look like. So we started in 2023 and did a service evaluation that asked our members and the people who attend our groups to name 3 things that help and 3 things that hurt in the helping relationship. After that, we went out to both different parts of the trust and the VCSE community, which gained us 30 plus partners to come together and decide what our project should and could look like. If I could have my next slide, please. So together we formed Healing by Nature, which is a trauma-informed relational health hub. And our ethos is to create a shared equal space that sits outside the traditionally hierarchical biomedical model, can't speak, which will allow us to create a reciprocal horizontalized health hub where power, trust and responsibility are all held equally between the people who use our services and the people who provide them. Really importantly, our service isn't just for whatever your word for patients is, it's also for staff, because we think that we can't look after the other unless we're also looking after ourselves. So it's really important to decrease burnout, increase staff retention and wellness, that we function as a space where we can have staff and the service users coming onto site and using it. And that really is reflected in the group. We have student nurses, we have our sustainability leads, we have the chief medical officer. Everybody that is interested can come along and be part of the service. And by embedding this relational practice at the heart of our group, we create a more authentic, honest and personalised service that really welcomes and truly sees people from all areas of our local community. If I can have my next slide, please. This one is a link, which if you're interested, I can send you a link to the video later. It's not going to work today for us, but essentially this video talks about what we're planning to put on site. And we're still in the desperately waiting for the sign off for our planning permission to come through. We're expecting it any day now. And what we've asked for and what we've got funding for is a wet relaxation area, which includes sauna, 2 cold water plunge pools, a wood-fired hot tub, moving down through the site and into a Neolithic roundhouse, which is being built in association with Cornwall College, so involving the local educational facilities. They've got a project on for people who are furthest from the workplace to come in and build this roundhouse for us. We've got plans for allotments, and currently the part of the project which is running and operational already is our campfire catch-up. So that will be serviced by 1 of 2 yurts that are going to be on the site. And we meet there every week to get together, have a trauma-informed group, find out how people are doing. We provide a free lunch, and we've also got various projects that we can do. So we built these benches that you can see in this picture. We're building dead hedges. We built our camp fireplace, which we cook over every week, and we do everything from bacon sandwiches to barbecues and everything in between. If I can have my next slide, please. So our community partners are many and far-reaching. Of course, we're very grateful to the Centre for Sustainable Healthcare, but we also meet with and include the Recovery College, Nature Connects, Hope in the Heart, which if you're interested in relational practice is a great national CIC who can help you embed that within your projects. The Eden Project, National Trust, there's loads of them there. If I can have my next slide, please. Thank you. From within our trust, largely, Growing Better Lives is actually a national CIC, but the Employment Placement and Support Service, CAMS, is involved. As I've said, our Chief Medical Officer is a real champion of the project. The Cognitive Analytic team, the fundraising team, the community mental health teams, obviously the Complex Emotional Difficulties team, of which our peer support group is a big part of that. And we do span from primary care, secondary care, and specialist services. There's no risk threshold to coming. There's no referral. You can just come along. We're reducing as many barriers as we can to attendance for people as possible. And it's all underpinned by supervision from the wonderful Dr. Rex Haig, who is a big part of the Royal College of Psychiatry. And he is central to formulating the enabling environment standards, which is a way to ensure that your project meets a certain set of rigorous standards and guidelines around. It's a sort of step down from a therapeutic community, but a therapeutic community model. And he is my supervisor on the project. If I could have the next slide, please. So as I've said, we've got these 2 yurts, roundhouse, camp kitchen, amphitheatre, allotments, wet relaxation area, and our lovely established woodland. We're hoping that we will be self-sustaining, although at the moment we're setting up through a series of grants. We will have 8 bookable site areas. We're hoping to charge £10 an hour. Importantly, that will be to Mind, to the CAMS team, to whichever the team is. All of the services that will be provided on the site will be done as a free to the end user or at the point of access. We're not expecting to reach that capacity immediately, and we're certainly working towards it very slowly here. Can I have my next slide, please? So we've got a lovely quote from Daniel Robbins, who is our psychology transformation lead, and he says that the project exemplifies the goals of transformation, delivering persons-led, needs-based quality interventions and support in the community close to people's homes, which is so important. By acting as a health hub where staff from the NHS and voluntary sector organisations can work alongside one another, a rich programme will be possible. And our objectives within that rich programme, as I've said, is to address both staff wellness, burnout and retention, to create a relational practice and trauma-informed service that addresses the estate's challenges. We know that our NHS buildings are increasingly old, they're increasingly square boxes with nothing in them, where we don't think that the most beneficial clinical work can be carried out. As soon as you take that work outside, you add a whole new dimension to it. So we want to also address health inequalities and include marginalised populations. And we think that by doing that, we're going to embody the aims of transformation. We're working towards being part of the Trust's net zero impact objectives, contributing to planetary health as well as human health. And this, we think, flips from patient to health generator in this health creation model. Can I have my next slide, please? Now, in terms of funding, we're very, very fortunate. We've had an awful lot of support for the project. So we've raised £164,000 from the Greener Communities Fund. And it always amuses me slightly that Starbucks is one of our biggest funders when we work within the NHS. The estates team has given us this Eco Smart Mobile Welfare Unit, and they've also given us, this says £40,000, but that figure has significantly increased since this presentation was written. That's towards our groundworks, but they're also supporting us with the planning permission, and we just recently were told that that cost has gone up by another £7,000, and there's never a, oh well we can't, or oh well, we must stop now. Every time that there is a little road bump like that, the estates team has said, how can we help, what can we do? So that's something that we're really, really grateful for. If I can have my next slide, please. Now, this says that it's in process, but of course time moves on, and we've largely done lots of this. So we've received £15,000 from Active Cornwall, which will initially fund the Green Gym, and in the future we're hoping to talk them into the sauna. Sauna's got great benefits in terms of dementia protection, getting, again, within nature, but separate from nature as well. We've had 500 tree starts secured from Natural England. Thank you for that. And also Natural England is included us in their lottery bid to promote connection to local heritage sites. Can I have my next slide, please? In 2024, we trained 80 people from across the VCSE and the Trust in Relational Practice. I've said our planning permission is now in. Design of our booking app, we need to minimise costs to the NHS. So we've got a booking app that's being designed for us that will handle all site bookings, whether you're an end user or a provider of courses. The timetable will be on there. It's linked to the Joy app, which is embedded within our primary care social prescribing sites. And that'll help us minimise the ongoing project running costs. As I've said, we're working with Cornwall College now to design the Neolithic roundhouse, and the best name ever for a toilet company, Call of Nature, is helping us design a sustainable self-composting toilet, and I really want those on site soon because I've got to keep my legs crossed else. Can I have my next slide, please? So the operational model, you won't be at all surprised to hear, is very collective. So the day-to-day running of the sessions, if you're running a Weight Watchers, a Cub Scouts group on site, we're expecting you to have your own robust governance, operational policies and procedures in place. However, there will be a collective site management committee composed of the people using the site from all groups using it, the people who run those groups, the community mental health team, which is located on the site, and we will co-produce universal site governance as the need for them is identified. Now, an example of this is, should children and adults be able to use the site at the same time? When we're doing in-reach into CAMS, so for people who are 17 and a bit, can they come with their mum or their dad, who's also a trust service user? And what does that mean for them? Is that helpful, unhelpful, etc.? Oh, we're running over time wise. I'll speak quicker. I've talked about the standards. I've talked about the app. I'll be the one managing it, and we can go on to the next slide, which is, I think we're nearly there now. Yep. So just to finish with some quotes from people who have attended. Healing by nature will help me get out more and help with the feeling of isolation, help build my confidence and my self-esteem. Having people around me for support that have had lived experience will really help, as they have an understanding of what it's like to have these daily battles. And another person saying what a huge difference having somewhere to go will be that's safe when struggling, as well as improving stuff like eating. And that's it from me, other than the final slide, which has got my contact details on it. And do please get in touch if you'd like the video or any more info. Thanks, everyone.
Thank you, Peter. Yeah, so we are running over time a little bit, but we'll still take a few questions, and then if anyone has to leave, we can we'll send you a recording. So but yeah, thank you so much, everyone, for sharing your fantastic work. I'm really excited to see how your project develops, Peter. So there was one question that I saw in the chat, which was from Helen. So do the speakers have any advice for estate staff in developing green spaces for patients in healthcare settings? So what would the one piece of advice be that you would give to them? Does that make sense?
I think that volunteers would really help, because you can make the most beautiful space in a garden, green space in a hospital or healthcare setting, but unless somebody keeps it going, you can really struggle. And I think I've seen now one or two beautiful gardens made, and then kind of they don't keep going because the regular staff in that area perhaps haven't got enough time. Estates teams don't have time, but volunteers are your friends, and they will make such a difference. We've developed 2 or 3 gardens now, and we've got a little volunteer group of gardeners that they come to Darwin Nurseries, but then they go to the other healthcare sites, and they not only sort of plant the gardens and make the gardens initially, but they go back and just keep on top of the weeding or encourage people to give it a water or something like that. I think that makes a difference.
I might suggest a bit of literacy. Is there something you can do around signage that encourages people to participate or to connect to that growing space in a different way? What Sandie said is absolutely fundamental. If we're not getting volunteers in to help support keeping those gardens going, but maybe as a step towards, if we're not quite there yet, can we develop some signage that's explaining maybe about a plant, or smell this, touch this, look at this, ways to just start to build that relationship with your visitors to be able to engage better with estates, and then you can develop more accessible growing spaces would be my suggestion.
And I would suggest getting everybody in the room, get all the stakeholders in the room, because you will discover partnerships that you never imagined were possible. You've got interested occupational therapists, mental health nurses, chief medical officers, your sustainability teams, and everybody's got a little bit of the puzzle, and together you will find a solution for whatever you're up against, is my experience.
Great, that's some really good advice. So volunteers for longevity of the project, signage to encourage interaction, and getting everyone in the room. There was one question from Alexis. So what have been your biggest challenges to get these projects off the ground? Big question.
Patience from here. Just realizing that it's not all going to happen immediately, and even once the money's there and the willingness is there, it still all takes time, and that you've got to be willing to stay the course.
Sandie or Emma?
Yeah, I agree with you there, Peter. I am a lone practitioner. I've got a horticulturist who supports me, so my resilience and stamina, and knowing that what I haven't achieved today, I might achieve next week. I've got a massive list of things, and outside of doing the provision, I'm buzzing around, just making sure I say hello to people. So, if you've got time to, I took some. We've got a vine at the trust, and we harvested about 200 bunches of grapes in the autumn. And I took one of the gardeners that I work with, who's a patient. We went up to the trust offices and just shared them around, just constantly trying to connect to people in different ways. So, keeping my resilience and my go-getter attitude has been really important.
Yeah, absolutely. As well as like chasing funding as well. I know, Peter, you're kind of full-time job, and then this is kind of on the side, isn't it? So it's just mad. Sandie, was there anything?
I mean, our service was pretty established when I started working there. So the thing that I found in the 3 years that I've been there is I just have to be creative and just get on with things. If I wait for the trust to do things, I might wait a long time. So I just get on and do things. And then I say, I'm going to do this. I'm going going to set up a cafe, and then I just go and do it, and I find a way to do it, because there's so many people that could be involved, and that can tend to slow things down. So yeah, I just crack on, and obviously do it in the right way, in a safe way, and then yeah. So that was the same with the cut flowers and the cafe, and yeah, as we develop and go forward, we just we get volunteers in, and we make a plan, and we just crack on and make things happen.
Maria's put, it's better to ask for forgiveness than permission sometimes.
I always let them know what I'm doing, just maybe not the detail.
Great. So one last question, and then we'll say goodbye. What's the best nugget of information that you have learned from your journeys? Anything's come to mind?
If I could jump in, I'd just say the universal appeal of gardening and nature connection, the wonder. I have gardened with people who are really experienced and who've been doing it, or they've connected to their grandparents through gardening. And I've worked with people who will have come out with me and planted their first seed. And everywhere across that journey, it brings wonder, it brings joy, it brings so much fun. And that's what keeps me motivated and keeps people coming out to the garden. So that's my little nugget of joy.
Lovely.
I would say let the people who are the experts do the bits that they're expert in. We've had such great links with people like Plymouth University who are going to do our outcoming, and they've developed a QR code for us so that participants can just zap a QR code and go straight to an outcome measure form. It takes seconds for them to do it, and we've got the hard copies that they're on site for people that don't have access to phones, but most of our members do these days. And we haven't had to do anything for that. And it's going to be a lovely little research study that we're going to be able to write up afterwards. And really, there are so many people who want to be involved in this stuff, and you can help them and they can help you. So it's a nice biodiversity model, I suppose.
Amazing.
Yeah, and I guess from Darwin Nurseries, the people are everything. The outdoors and the opportunities that horticulture provides is the tool, but the people are everything. They're the heart of Darwin Nurseries, and they're the heart of the service, and everything that we do is to support them. So it's always to keep, where I work, it's always to keep that in mind, and everything else is kind of subsidiary. It's a part, it's the tool that enables us to get the best out of the people and the environment. So yeah, it's all about the people.
Lovely. Well, thank you so much. We've run 10 minutes over, so thank you for all holding on anyway. Yeah, thank you so much to you three, Sandie, Peter, and Emma. Absolutely fantastic, really incredible projects, really broad work. It's just awesome, and I'm really hoping I can come visit all of you at some point. If we will send the presentations and a feedback form, and if the presenters want to share their information again, we'll include that in that email, so you can contact them if you had any further questions. But yeah, thank you so much. Yeah, really good. Loads of good feedback in the chat. So thank you so much for your time. It's great. It's been really brilliant to hear a bit more about your project. Cool. Thank you.